Welcome to Observations, the weekly show about what's happening now and in the future. I'm your host, Fred Conquest, and today's topic is healthcare and the Affordable Care Act. My guest today is Patrick Casal, who has 26 years experience in the healthcare and health insurance industry. He is managing partner of Multicare Corp. Thanks for coming to chat with us about this important, pressing topic. And now, before we get into the devil in the details, I'd like to point out that most people tend to mash up healthcare and health insurance. In reality, they are two different things. Healthcare refers to the products and services available given by healthcare providers, doctors, nurses, hospitals, pharmacists, and other licensed professionals. An important point is that all of these healthcare professionals are licensed by the state and not the federal government. Health insurance is based on the model of providing a payment platform, in today's terms an app, that is simply a third-party intermediary between people and healthcare professionals to facilitate payments. People pay a fee, a premium, to the insurance company. The insurance company pools these premium payments and pays the healthcare providers for services rendered from the premium pool and charges fees out of the pool for making the payments. Not rocket science, but it can be confusing and convoluted. Much of this confusion is done on purpose to make insurance benefits complicated for the simple reason the insurance company wants to inflate premiums paid by people. Welcome to Observations, Patrick. So, Pat, let's start our conversation with this question and go from there. What is your take on the present healthcare situation and its relation to health insurance?
It's a disaster. It's very simply put, it's a disaster. We're in a situation right now where both hands are on two different bodies. You have the insurance debacle because the government got involved, and you have medical care lost in the quandary of everybody wants to go to the doctor for $5, $10, $20. It was done before, and the reason things have changed, and you've touched on it, is that there's a disconnect between what a consumer should pay, what the insurance company reimburses, and the premium we pay the insurance company. In my mind, where we don't agree because of the Affordable Care Act right now, the insurance companies are limited on their profits. The reason their premiums are so high are simply because the cost of insurance isn't even close to the cost of the expenses that they're administrating. Carriers have had to cut back on the adjudication of claims because they don't have the money to pay for all the services. So essentially, you have a spiral that is hurting everybody on every level.
The one thing that I think people fail to realize is that what we really have here is three competing interests: the people, the insurance company, and the medical professionals. And all of them are trying to get the best deal possible for the least amount of money. And the model that they chose in this Affordable Care Act is not really that good a model. What do you think?
I couldn't agree with you more. The reality is, when the Affordable Care Act was passed, it was based on a concept that we're going to reduce premiums by $2,500. Insurance would be easily delivered. Out-of-pockets would be minimalized. Premiums would be minimalized. But then they added all these mandates saying, hey, this is going to be free. That's going to be free. This is the way it's going to be covered. You pay a minimum about this, a minimum that. And before you know it, premiums have exploded. The reality is the insurance companies, what their job is to make sure that the costs being charged by the carriers are properly charged based on the contracted discounts that the carriers obtain. So they have, in that perspective, they've always worked well. The big complaints is that the premiums are rising and people couldn't keep up with the premiums. Frankly, what's really been out of whack is the reimbursement to the hospitals, the reimbursement to the specialists, the reimbursement to Big Pharma. Those are the problems in America. It's not necessarily doctors overcharging. It's the big facilities overcharging. And then when you see repricing on an explanation of benefits, you're seeing 10 cents on a dollar actually being accepted for some major claims. My problem is, and where we agree, is why can't you just have a flat number across the board, and then you would stabilize the entire marketplace?
Patrick, Big Pharma seems to not really care much about the problems they cause with their pricing that essentially from the economics point of view, we're going to pass all of the costs onto the people and we're going to take all of the profits.
Couldn't agree with you more. And unfortunately, it's America. You know, it's interesting that we can purchase a drug manufactured in the United States, in Canada, for 50 cents on a dollar or less on a brand name drug. That's ludicrous. And the reason is simple. In Canada, they control the cost of Big Pharma. Our government hasn't. When they passed Medicare Part D for senior citizens, Bush himself made it whatever they want to charge. I've always contended that we need to use the VA as a negotiating arm for all seniors. Big Pharma claims that the reason they charge so much in the initial years of a drug is for research and development. But research has proved that they're full of baloney. 17% of the money they take in is in actuality going to R&D. The rest of it's going to line their big pockets on because they're very top heavy. And who's paying for it? The American people, and that's wrong.
Well, a hip replacement costs roughly $40,000. In Spain, it's $7,000. In India, it's like $1,400. How come these discrepancies in prices are even allowed to continue? Because what they're really doing is impoverishing the lower rungs of society and the middle class.
Here's the deal. As a health insurance provider, as a broker, we have a lot of questions about what happens if I go see a doctor outside the United States. And I laugh because the insurance carriers want to say, well, that's out of network, and they want to make you pay the brunt of the claim. But isn't it interesting that if you had to have a surgical procedure in India, Israel, it's significantly far less than they would get charged here. You would think the insurance company would embrace it and want to pay for it. Yet, if you have that same procedure done in the United States, it could cost them 4, 5, 6 times the charge. It doesn't make any sense. I firmly believe that if the federal government truly wanted to provide a true healthcare system, they would control the cost or cap a cost and essentially allow people to shop for care. So, like for example, number one wants to charge $10,000 for the service, $7,000 from number two, and number three is $5,000. And as a consumer, we could find out which doctor is the most efficient, which is the better deal. It's almost like Medicare Part D. You have the high to the low, and right in the middle. And the middle always seems to work the best. And that's really what we need in healthcare, in my opinion.
So, what about the doctors and medical professionals who refuse to take various insurance? They don't take Medicaid, they don't take Medicare, and yet they took an oath to do no harm. And, just because you're doing no harm, say, in actually treating somebody, you're doing harm to the whole population by refusing to participate.
I see both sides of that picture. First of all, for a physician who has a Hippocratic oath that he'll take care of the weak and the sick, it makes sense. But in this day and age, with the cost of doing business becoming so ridiculous, the fact that we're a litigious society, we'll sue a doctor for anything. We've made doctors gods. And because the reimbursements from the insurance carriers are getting smaller and smaller and smaller, the physicians can't afford to do certain services in their office. And they're afraid if we do it this way, we're limiting ourselves to what we can do for our patients. On the flip side, being a participant as a provider, whether it be a health maintenance organization or a PPO, those providers that are working, they are working for a fraction of the cost. Some of these insurance reimbursements are very, very, very short, especially on the HMO side. For that matter, if you look at some of the models like a Kaiser or a Health Plan of Nevada, those physicians are actually captive employees. They actually work for the healthcare company. So there's really a catch-22 there we can get into later. But the bottom line is those physicians are looking to get paid a straight salary if they work for an HMO, and their expenses are capped. So it's easier for them to do business. They don't have to worry about the daily grind of covering this expense, that expense, especially their medical malpractice.
Well, it's probably in the ballpark that every doctor who has his own practice probably doesn't see $1 in profit until he spent $180,000 he gets 180,000 or more in revenue simply because it's $15,000 a month just to keep your office. It's just open the doors.
When you're talking about a doctor who practices medicine the right way, I agree, 100%. And you have those doctors that have their concierge practices that are making a killing. You know, the truth be told is, I don't have a problem with anybody making a profit, especially if they're exceptional. But by the same token, it shouldn't be at the expense of anybody. And we have that in every industry. It seems that, you know, attorneys, you know, they sue for anything. I mean, if you a fender bender, if it's a scratch this big, they're trying to get $100,000. That hurts us. Having physicians that don't practice medicine the way they should, that hurts us. But I still believe in the capitalistic way of being able to shop for the best deals. And I think that if we were to provide a system where caps were in place and allow the consumer to really look for a good deal, they would find it.
Well, in almost any medical office, there's no listing of what the services cost.
And that would be common ground. I mean, it's interesting. You can go for LASIK surgery and you can get a pricing. You can go for a lot of different plastic surgery, nose job, et cetera. You get a pricing. But why can't you get a pricing for like an MRI, or why can't it be published that this surgery is going to cost X or Y? And I think that's always been a problem. And Obama made the claim that this will be the most transparent presidency in the United States history. And I think he fibbed a little, just a little.
Well, most of the pharma and the practitioners, they don't want other people to know what the pricing really is, and they're really probably reluctant to even put out the costs.
You know, when you look at an explanation of benefits and you look at the exact cost being charged, on an EOB, you'll see the date of service, the code, the amount charged, the discounted amount, the amount you pay, and the amount the carrier reimburses. When you look at that across the board, if you really look close, you can see what the cost really is. And it's unfortunate, very unfortunate, that most consumers never really follow how a billing is processed or adjudicated.
Well, basically, they get the bill and they go,
Yes and no. Sometimes people just look at the bill and say, I owe this money. I mean, today, for example, I met with a client who has about $10,000 worth of debt, and it's impossible. His out-of-pocket max was $4,000. And he was being told by his wife, well, you owe the money, make payments. He got me involved, and I'm like, dude, you don't owe this money. And we called the collection agency, and we were able to reprocess it, and guess what? He doesn't owe the $10,000. And that's not the first time in my career I was able to do that. I had one lady, when I was working with the school district, who owed the hospital $30,000. I said, it's impossible. And she said, well, the insurance company said there was a cap on this service. What was the service? It was a pacemaker. I said, it's impossible. Sure enough, I was right. The billing was wrong. She had money going back to her. The hospital actually owed her and her husband money. The bottom line is, you meet with an insurance professional, not necessarily an agent, but a professional who understands adjudication of claims, et cetera, and you're way ahead of the game. It's not, the biggest problem in America is people don't understand insurance. They don't understand what they're buying. And when they put forth the Affordable Care Act, the idea was it's like buying plane tickets. Wrong. Because the average person is going to buy the cheapest plan until they get sick, and then they're going to realize, holy Moses, this is not what I wanted.
well, the other thing too is you're looking at, we'll say, $200 a month premium. So $2,400 a year. You can't write that off on your income tax. You also may have a $5,000 deductible. So you're paying, you don't even see any insurance return until you get to $7,500.
In the way it's designed, yes, but the truth be told, a lot of plans have copays. The only good thing about the Affordable Care Act, the only transparency, is the out-of-pocket maximum. A deductible plus co-insurance plus all the copays is capped. This year in 2017, it'll be $7,150, not counting premium. So you know your out-of-pocket is limited to $7,150. Again, the average person is $500 away from being homeless. Where are they going to come up with the $7,150? Worse than that, the $200 number you're talking about would only be for somebody who's getting a tax credit. If you're in the middle class and you're 50 years old, that premium is $6,000 a year. So you're looking at $13,000 a year for the average person who's 50 in the middle class, America. And that's not a feasible number. That's almost a house payment in most cases, a nice home.
So how can we at least get some traction on solving some of these problems?
You know, it's interesting. Again, I'm cheating. I have a cheat sheet here that I created. I have 12 magical ways to reduce premiums, a minimum of 40%. It's probably greater than that, but I'm gonna be conservative. The first thing is to allow insurance premiums to be deductible. You touched on it a moment ago. Any insurance premium is deductible, you immediately reduce premiums by 15 to 30% just because of a tax bracket. That would be people getting an incentive to buy insurance. The second thing and most important factor would be to change the medical ratio. See, in the old days, it was either 5-to-1 or 6-to-1 on a ratio. What that means is an 18, 19, or 20-year-old would pay, let's say, $100, and a person 60 to 64 would pay $600 or $500. What they've done is made it 3-to-1. Well, the seniors rate remains the same. They rose the youngsters rate. Now, the big thing we hear on from everybody, all the politicians, is the most important thing we need to do is get the younger invincibles engaged. Well, here's the thing, Fred. When you and I were 25 years old, what was more important to us, the ride or a $250 or $300 health insurance premium?
Well, I paid $25 a month.
I'm talking today, though. I mean,
Yeah.
Make it all relative. I mean, the reality is today, we're asking youngsters to pay $250, $300 a month, and they have a $5,000 or $6,000 deductible. You know what they're saying? No way.
Forget it.
First of all, I can't pay the $5,000 or $6,000, so why am I paying the insurance?
Right.
But I'll buy the car. I get something for my $300 a month,
Right.
And that's the reality. And then to sit back and say, well, we're going to fine you, or you're going to get taxed if you make $20,000 or less, $695 or 2.5% of your income. The number still doesn't equate to $3,600 a year or $3,000 a year premium for somebody in their early 20s. So what ends up happening? We're not getting the pool we need to spread the risk. We have adverse selection, which is the number one reason the death spiral is kicking in, because you have more sick people buying insurance today than ever before, and the healthy are paying the fine. Just today, I had 2 clients, 2. They called me on the phone. One's an insurance broker who's in his 50s. Him and his wife are going to be billed $12,000 a year for insurance. That's it. I'm done, he said. I have a HSA plan. I'm responsible for the first $6,500, and they want this kind of money out of me. I'm done. I'll pay the penalty. The other gal at the dentist office is on the Affordable Care Act. She's on Obamacare. Her premium is going up to over $200 a month, and her deductible is $6,000. You know what she said? I can't afford you $200 a month. And I definitely can't afford $6,000. Her response to me is, you know what? If I get sick, I'm going to UMC, and I'll file medical bankruptcy. And that's the truth. That's the reality that none of the politicians touch on. They want to sit there and say, oh, it's really working. It's all great. You're crazy. It's not. Unless you're making very little money, which is about $16,900, or you're getting the maximum subsidy of tax credit, and you receive a cost sharing reduction in your medical expenses, it's not working. It's broken, and it's broken bad.
One of the things is that the state could regulate doctors. In other words, you take insurance, okay, or we cancel your license. All right? Simply because the state gives them the right to practice medicine. And the other thing with the big pharma is they're advertising all of these drugs, which may work for a minimal number of people, and yet the side effects probably cost more to fix than what they're saving by taking the drugs.
That's called contraindications. And it's funny because certain medication they give you other medication to offset the side effects. It's kind of an interesting tangle they set up, and you're in the web of destruction, and it could cost you long term. That's why people end up getting sicker later on. I don't agree with you on the fact that the state should regulate and tell doctors if you don't accept insurance, you can't practice. That would be something I couldn't agree with. Just because I believe if a physician opens up a practice and puts a price on the board, and you came in and you're willing to pay that price, that should be fine.
That's no problem, but they don't put the prices on.
Well, now that's a different ball. I think all prices should be marked. There's no reason why you can't have a bulletin board that says, for the doctor fee is $50. If we do blood work, it's an extra $30. I mean, that's easy, and I agree with that. But I don't think the state should regulate and say, hey, you need to take insurance. because some of these reimbursements by these insurance companies are getting tighter and tighter.
Oh, yeah. A few of my physician friends who do take insurance, they don't even get paid for 6 months, 9 months for services. So they got to go to the bank and borrow money to make the payroll and wait for the checks.
You know, part of that problem, though, in the physicians against the physicians is, and that not every case though, but in most cases, they have a problem with affording proper billing. So what happens is the carriers get these bills that are not clear enough, and so what happens is I get a bill in the mail. Like for example, I go in for my annual exam. I'm fighting right now with Quest over $25. They're saying you owe the money. And I said, what was the date of service? And they gave me a date of service. I said, well, I went to your facility. I had to pay. Well, we need proof that you paid. So I sent them the proof. Well, that's not the date of service. It's the date of service, but no, we made a mistake. It was back 2 months. Well, wait a minute. You know, so the billing departments in a lot of these medical offices aren't run as efficiently as you would expect. So that does put in a delay. Again, the entire system, the entire mechanism is broken. Can it be fixed? Yes. But a lot of medical offices are getting destroyed. Like, for example, I know one gynecologist who performed certain services in his office with a piece of equipment. The reimbursements became so ridiculously low, he got rid of the equipment. He does it in the hospital and gets full fee. Whose fault is that? That's the insurance company's fault. They're not being practical. So I'm going to pay in the hospital 10 times what I would pay in your office? That doesn't make any sense. So really, we have fault on all sides. And the government's intervention has only made it worse. I mean, when you're asking an insurance company to be capped at their profit, then they're going to raise rates to make sure that they don't lose money because they can't recoup next year and raise the rates to cover the losses under the law. Those are big problems.
Well, for an insurance company to have no cap on their risk, which is essentially what the Affordable Care Act does.
Right.
Okay, you got to be an idiot to not raise prices because you have no idea if somebody's going to get a heart transplant and it's going to cost $1 million.
You know, I had this argument yesterday. First of all, if you were to cap out-of-pocket maximums, lifetime maximums at $10 million, you could reduce premiums by about $10 per person per month. Unlimited's probably around $24 to $28. If you added about $10 million, it's probably right between $10 and $12. Okay. The reason that a cap being implemented makes sense is that carriers are paying at a discounted amount. The bigger the service, the bigger the discount. So if you get $1 million claim, reality is they're probably reimbursing about $300,000. So to spend $10 million is like having $25 million worth of coverage. If you did that, that would work. And now with the guaranteed issue provision, you could always switch carriers. The reason that carriers are leaving the industry or leaving the marketplaces is they're losing money because the only people that are buying the insurance are sick. Also, carriers are cutting the distribution market. And here's why. Before the Affordable Care Act, only insurance provider or insurance agents were writing the business. Well, because of the guaranteed issue and the open enrollment window, what the medical offices were going to do in like a dialysis center, they would get one of their employees contracted with a carrier. A patient would come in who was uninsured. They would get them insured during an open enrollment. They would buy the richest plan possible, pay their premium, eat the out-of-pocket expense, and bill the carrier. The carrier would be paying $300,000 to $400,000 or $500,000 on that premium. That's one of the reasons why you're not seeing the platinum plans being offered in the off-exchange market or the real rich gold plans. The carriers are getting beat up, and they got beat up by the very providers they're contracting with. So you really have a system of failure here that's being upheld by a government that has no clue onto healthcare. And they talk about the 20 million people they've insured through the Affordable Care Act. That's a fallacy. It's more like 12 million now. And of the 12 million, I think it's about 7 million on Medicaid. Only 5 million people are being insured through the exchanges. And of the 5 million, I want to say 3 million were uninsured before. The other 2 million had coverage.
I'd like to ask you a question about what I think is one of the really serious problems. We're turning a huge number of people into essentially heroin addicts with OxyContin. And there's only one company that manufactures that drug. And people seem to fail to realize the externalities of doing that in terms of what it costs to get people off that drug, simply because the easy way to get rid of pain for people is, here, take 2 of these and call me in the morning.
You know, I have a personal experience dealing with medical addiction, not personally, but for family members. And let me say that I believe that the physicians today, in those cases, those extreme cases, only practice writing out prescriptions. Certain drugs, Oxycontins specifically, depending on the milligram, should be really limited. They're usually cancer drugs, where maybe latter stages. When you're giving somebody who hurt their back Oxycontin, you really are doing people a disservice. And the other thing is that when people have pain, pain is God's way of saying something is wrong. And sometimes you have to live with a certain amount of pain and you want to limit it. There are extreme cases of pain that are implemented through maybe an arthritis. And I understand certain medications. But I will sit here and say to you point blank that some of these physicians that practice writing out prescriptions are glorified drug dealers. And that's a problem.
Oh, yeah. And then the other thing, too, is all of the big pharmas against the CBD, cannabis oil, and which is proven to help alleviate pain and the PTSD symptoms.
Mark my words, you're going to see big pharma in that business. And that's one of the reasons why some of the people that have invested in the medical marijuana are looking forward to them passing laws across the board, because once that becomes totally legal in the American system, those people that own grow houses and distribution chains are going to get bought out by big pharma, and they're going to make a killing. That's the anticipation of the law being passed.
Okay, great. Our time is about up for today, so I'd like to say a big thank you to you and to all the people watching out there. We hope we have enlightened you somewhat about what is happening today on an important topic and given you some ideas about how to make sense out of it. We will see you next time to discuss another important topic from the list of what's happening now. Until then, as Mr. Spock always said, live long and prosper.
Thank you. It's great to talk to you.
Okay.